our initial testing, I think, the strongest effect. CBD was good as well, but there's a lot of research on CBD, so we decided to pursue something that people were working on less actively,
Okay. Yeah.
just to explore, kind of
Yeah.
provide a broader picture of the field. There's a couple of others now that are more effective than CBN in cell culture, but we haven't explored those very far. We don't have the funding to do that right now.
Yeah. Yeah.
It would be
So,
something potentially for the future.
yeah. But based on what we know about cannabinoids, most or all of them cross the blood-brain barrier. The fact that you
Yeah.
saw this in vivo result in mice suggests that CBN is getting into the brain at these doses,
Yes. Yeah.
and it's passively administered in their food,
Hmm.
and it has measurable effects. Um, is there any? I would imagine that there's probably not a lot of motivation out there to do clinical trials with something like CBN.
Um, I, I don't know, because there are companies that are specializing in some of these cannabinoids, and um, they have done clinical trials for other aspects, or CBD. They the For some other aspects of CBN. I mean, Alzheimer's is tricky because, it's a long trial. There might be some other shorter term trial that could be done much more. And plus, if you're starting to talk about Alzheimer's patients or people with MCI, that gets a lot more complicated in recruiting people and putting them into a trial. So there might be possibilities for looking at just older people with what's called subjective cognitive impairment, not worrying about whether they're it's Alzheimer's disease, and maybe shorter term trials. 3 months or something, and just seeing if but placebo controlled. That's the critical thing.
Mm-hmm.
That it's because, yeah, placebos have effects too. So and sometimes as good as the drug you're testing.